Today we have Mrs. L to protect her identity. Mrs. L had bilateral ReSTOR implants plus 3 ads in June of 2009, and Mrs. L was actually very apprehensive about the relatively new technology of the multifocal lenses. And when she had come in, she had a lot of questions, more than usual, and we had several visits in which we had to spend actually, more time than usual explaining to her about the risks, benefits, and alternatives of cataract surgery. So let's chat with Mrs. L, and today's date, by the way, is February the 3rd, 2010, and let's find out how Mrs. L is doing with her vision now. Mrs. L, good having you this afternoon. Can you tell us just for a moment what you do for a living?
I teach at an elementary school. I teach art.
Okay. So I suspect a lot of what you do is probably up close, more so than at distance.
Yes.
Okay. And today's measurements, you were seeing J1 plus up close, which is equivalent to about 20/20 up close, and you're seeing 20/25 at distance out of each eye. Are you using glasses for any activities at this point?
No, not at all.
Okay, excellent. That's great to hear. And are you able to read the newspaper?
I can read anything.
Anything?
Anything.
Wow, that's impressive. Are you able to, now do you ever slip on a pair of reading glasses from time to time? So there's no need for that?
No.
Okay, I don't want to put words in your mouth there.
No, I just use sunglasses during the day.
Okay, excellent. And did you wear glasses before surgery?
All the time.
All the time, okay. So how does it feel now to be glasses free?
Well, it felt kind of strange at first. Every now and then I'll find myself reaching for them, then I realize I don't need them, or I don't have them.
Excellent, excellent. If you could share with other patients and to young doctors that are interested in implanting these lenses, what advice would you give other patients first, and then what advice would you give to young doctors to help them educate patients, to make them feel more comfortable about this new technology?
I would tell a patient to have it done. It's wonderful. It's not that much to it, really. And you take a lot of eye drops, but other than that, it's not bad. It's really good. I'm really glad I had it done. And I think to doctors, I would just simply say, if at all possible, if another patient who's had the same lenses implanted, to have that person talk to a new patient if they're apprehensive about it.
Okay.
So.
Super advice. Thank you so much.
You're welcome.